Hi, our project looks at COVID vaccine hesitancy and vaccination trends. And our project aims to analyze the ongoing COVID-19 pandemic and the impact of COVID-19 vaccination in the US. We first investigate trends of deaths by age, sex, and race, which has identified that the elderly and men are the most vulnerable without fully capturing a pattern within race. We in turn examined more generally the progression of the COVID-19 pandemic in the US and then stratified the data into pre and post vaccine availability to see in real time how the vaccine has affected the trajectory of cases and deaths in the US. We then explored the real world data on how vaccines change death and case rates and compared this to our model of expected cases and deaths after vaccine rollout. The blue line here represents the modeled caseload after vaccination, and the black line represents projected cases without vaccination. We found that the actual number of cases post-vaccine was greater than the modeled case rate. And although the actual decline in case rates is not as significant as seen in our modeled vaccine effectiveness, it still shows a considerable decrease in new cases compared to a hypothesized population without vaccination. And here we showed the interactive map and graphs related to vaccine uptake over time in the US. And to our surprise, the uptake rate stayed constant, floating around the 40 to 60% rate throughout the states and time.
We wanted to look at what factors influence vaccine effectiveness in the earlier stages of rollout by looking at COVID vaccine hesitancy. We saw that there is an overlap between high social vulnerability and a high percentage of vaccine hesitancy. These findings are important in our understanding of why some individuals may be reluctant to accept the vaccine. Future studies should focus on whether there are specific elements of social vulnerability that contribute to vaccine hesitancy more than others and whether they can be modified.